Plans are afoot to build a new hospital on St. Kitts in the vicinity of the International Nursing University in the West Farm area. Prime Minister and Minister of Health, Dr. Terrance Drew, spoke about these plans in a special interaction with the media at the Koi Resort on Thursday.
We need a smart hospital. Smart hospital meaning we need a climate smart hospital, and of course one that is technologically driven. Why do we need a smart hospital? With the changes in the climate, and all of us are aware of climate changes, we are expecting stronger hurricanes. We are expecting more dry seasons. We're expecting also the insidious changes that will take place. So therefore, the hospital that we have, based on what is taking place with the climate, it is not in good stead to withstand that. So this is not even a choice that we have in the matter. As a matter of fact, a lot of our infrastructure needs to change because we have to make the infrastructure more resilient, climate resilient. Our houses need to reflect that as well, not just the hospital. So I want to say we do not have a choice. The hospital where we're at, if we were to do some repairs there, as persons were suggesting, or upgrades, when you look at the scope of work of the upgrades that will be required, you might be running into a cost that can almost approach the cost of a new hospital. That's the other issue.
Dr. Drew disclosed that the new hospital could cost over $30 million and that there's a possible source of funding of up to $50 million already identified. Other options, he said, are being looked at.
We have an estimation of a cost of it with everything. One of the costs that were given to us was $23 million to build the hospital without the equipment, and with the equipment could be another $10 to $15 million. We are looking at various sources of funding. One of them, of course, is a concessionary loan, which we are considering, very low interest, with a grace period of about 3 to 5 years, and the payment plan is very, very affordable. That is one of the things that we are looking at this point in time. We'll seek donations also to help us to do that. So we have already we have a good source of funding already of about $50 million, which is a good concessionary loan, which gives us that period of time in which we can pay it back. That's one. We can decide other routes in which we want to approach it. But just to say that we have an excellent source of funding and we will pursue it.
The Prime Minister also disclosed that in a bid to improve customer service at the hospital, an assessment is being done to determine areas of concerns and the necessary training will be provided to hospital staff. He also said that the intention is to have a high-level hospital facility that can attract medical tourism to the country, where people come to St. Kitts and Nevis for treatment. Andre Huey, SKN Newsline.